Good day, sir. I am Patricia Manuel, a student nurse for today. So today, I'm going to demonstrate AV fistula, cannulation, and decannulation. So let's verify first the patient. Then provide privacy. I will close the door or the windows. Then explain the procedure to the patient and how the patient will cooperate. Then perform hand washing. So I already hand wash my hand. Then assemble the supplies. So prior for the assessment, we can use IPA or inspection, palpations, and auscultation. So for inspection, look for sign of infection, edema, Still syndrome. And then for palpations naman po, feel for the pain, skin temperature, growth vessels, and for for auscultation naman po, you can listen for bruit sound or is a whooshing sound. If there's any abnormality on APA, no cannulation, and then report it to the healthcare team. So we can now proceed to the procedure. So assuming that I already washed my hand, and then I will now put a gloves. Then I will now already wearing my PPE. Okay. Then after that, I can now inspect for the edema. Okay. I will now inspect. Then inspection. Then after that, I can now using my 2 fingers, I will now palpate the area. Okay. The arterial and the venous. Okay. Then after that, I will now auscultate. So, since there's no abnormality, we can now proceed to the procedure. So, I will now do a skin preparation from inner to outer, then discard, then again, from inner to outer, then discard.
If the access is AV fistula, apply a tourniquet above the fistula to distend the veins and facilitate the puncture. Avoid occluding the fistula. If the access is an AV graft, there is no need to apply tourniquet.
For new AVF, use 17-gauge needle. In needle insertion, either use the 2 techniques, the C technique and the 3-point technique. Insert the arterial needle first into the fistula away from the arterial venous anastomotic site. Insert the venous needle a few inches proximal to the arterial needle. Insert needles at least 4 to 5 cm away from the anastomosis with the bevel facing up. Slide the cannula through the skin and into the vein until first flashback is seen. This indicates that the needle tip has penetrated the vein. Lower the angle at 25 degrees and advance the tip of the cannula and still look for the flashback. The distance between the 2 needles is 7.5 cm away. Be careful not to puncture the posterior wall of the access. Then, prime the needles, open the clamp, loosen the cap, and prime the tube all the way to the edge to check for patency of the fistula. Close the clamp. Then flush the needles with saline syringes. Place the syringe open to the clamp. Pull back the syringe first. Make the air go up, then flush with no air to introduce. Then, secure each line with adhesive tape. And then, remove the tourniquet. Observe the backflow of the blood.
After cannulation, we can now do a aftercare. So assuming that I already do a aftercare, then I already put another gloves for decannulation, and then I already wash my hands. Then after that, I will now remove the tape. Then using a alcohol. Then using this gauze, actually this is the gauze pad, then put a pressure, then same direction, then all of this part, then actually I already removed this one, then again put a pressure, then this part, then using our two fingers, or let the patient as na kung pwede lagyan ng pressure at least 10 minutes. Okay. Then do a aftercare again. Aftercare. Okay, aftercare. After that, I will now remove my gloves. Then discard. Then perform hand washing and then alcohol. After that,